Good day, I am Yakina and Sano, and today we will be presenting to you the autobiography of hypothalamic agents, specifically the agonist.
My generic names are goserelin, histrelin, luprolide, nafarelin, and tesamorelin. For my brand names, they are Zoladex, Vantaz, Lopron, Sinorel, and Egrifta. And for my chemical name, it is for drug classifications for luprolide. For therapeutic, I belong to antineoplastic luteinizing hormone releasing hormone agonist. And for pharmacologic, I belong to synthetic analog of gonadotropin releasing hormone. And for my pregnancy category, I belong to pregnancy category X. And now for my mechanism of action, for my chemical effect, I initially stimulate but then inhibits the release of gonadotropin releasing hormone, resulting in testosterone and estrogen suppression. And for my therapeutic effect, I hinder prostatic cancer cell growth, eases signs and symptoms of endometriosis, and inhibits progression of puberty in children. Also decreases uterine and fibroid volume.
For my pharmacokinetics, I am typically administered as a single dose, long acting formulation employing either microsphere or biodegradable solid depot technologies. I am apparently a steady state volume of distribution of 27 liter following intravenous bolus administration to healthy males. The volume of distribution for indicated routes of subcutaneous or intramuscular injection has not been reported. I displace in vitro binding to human plasma proteins between 43% and 49%. I am primarily metabolized to inactive penta, tri, and dipeptide entities which are likely further metabolized. For my elimination, I am excreted in the urine. For my half-life, I have a terminal elimination half-life of approximately 3 hours. And now, for my indications in advanced prostate cancer for men, 1 mg subcutaneously daily or 7.5 mg IMD pot injection monthly or 7.5 Eligard subcutaneously once monthly or 22.5 mg IM every 3 months or 22.5 Eligard subcutaneously every 3 months or 30 mg IM depot injection every 4 months or 30 mg Eligard subcutaneously every 4 months or 45 mg Eligard subcutaneously every 6 months. Endometriosis in women, 3.75 mg IM a single injection once monthly, or 11.25 mg IM every 3 months. Recommended duration of treatment is 6 months. Central precocious puberty in children, initially 0.3 mg per kilogram IM depot injection as a single injection every 4 weeks. Increase dosage in increments of 3.75 mg every 4 weeks. If needed, this will be considered the maintenance dosage or 50 mcg per kilogram subcutaneously daily. If total down regulation isn't achieved, increase dosage by 10 mcg per kilogram daily. This becomes the maintenance dosage. Stop drug before girls reach 11 and before boys reach age of 12. And lastly, in the uterine lymphomata for women, 3.75 mg IM monthly or 1 dose of 11.25 mg IM with iron therapy. Recommended duration of therapy is 3 months or less. And now for my contraindications, I am contraindicated in patients who are hypersensitive to drug, its components or other gonadotropin-releasing hormone analogs, and in women with undiagnosed vaginal bleeding. Use me cautiously in patients who are hypersensitive to benzyl alcohol, allergy to any component of the drug, peripheral vascular disorder, rhinitis, renal or hepatic impairment, and lastly in pregnancy or lactation.
Now for the side and adverse effects. Increased release of sex hormones, ovarian overstimulation, flushing, increased temperature and appetite, fluid retention. In the central nervous system, depression, dizziness, headache, pain. In the cardiovascular system, angina, arrhythmias, myocardial infarction, peripheral edema. In the gastrointestinal system, nausea and vomiting. In the genitourinary system is impotence. In the musculoskeletal system is decreased bone density, transient bone pain. In the respiratory system is pulmonary embolism. Skin is skin reactions at injection site. And lastly, in the others is decreased libido, gynecomastia, and hot flushes. Moving on to the nursing responsibilities. Before administration of the drug, assess for contraindications or cautions, such as history of allergy, pregnancy, serious infection after open heart surgery, and etc., to avoid adverse effects. Second is assess height, weight, thyroid function test, glucose tolerance test, and growth hormone levels to determine baseline status before beginning therapy and for any potential adverse effects. During the administration of the drug, reconstitute the drug following manufacturer's direction. Second, monitor response closely to determine need for dose adjustment. Third, monitor thyroid function, glucose tolerance, and growth hormone levels periodically to monitor endocrine changes and to institute treatment as needed. Fourth, provide comfort measures to help patient cope with the drug effects. Fifth, provide patient education, such as storage, preparation, administration technique, and all about the drug effect and warning signs to report to enhance patient knowledge and to promote compliance. After the administration, monitor patient response to therapy, like the return of growth hormone levels to normal, growth and development. Second, monitor for adverse effects, like the nutritional imbalance, hypothyroidism, and the likes. Third, evaluate patient understanding on drug therapy by asking patient to name the drug, its indication, and adverse effects to watch for. Fourth, monitor patient compliance to drug therapy. That would be all. Thank you for watching and God bless.